Here. In this video, I will be talking about the concepts of fetoplacental barrier, prochordal plate, notocord, all the stuff. Let us go with the first thing. Let me read first. The first thing written in our notes is fetoplacental barrier. From outside to inside, endothelium of maternal blood vessels, syncytiotrophoblast, cytotrophoblast, right? Then you have got an embryonic somatopleuric mesoderm. Then you have got a fetal blood vessels, that is endothelium of fetal blood vessels. So let us understand what is it trying to tell us, right? So let us go with the concepts here. So this I already spoke in the last video, but let us revise for better understanding this barrier. So you can see this. This is what, right? Epiblast, hypoblast. You can see this, and this is what amniotic cavity, and you can see this is your cavity. This hypoblast, right? You can see it forms a mesoderm, right? You can see this mesoderm, and this is extra embryonic. It is outside the embryonic mesoderm. And this mesoderm again divided into the mesoderm which is covering this amniotic cavity, right? And these trophoblast at this position we call it as somatopleuric mesoderm, and the which is covering this yolk sac, right? The mesoderm which is covering this yolk sac we call it as splanchnopluric mesoderm. And you have to understand this is trophoblast again divided into cytotroph, and they are in a proper shape. But these syncytiotrophoblast, they are not in a proper shape. The nucleus is scattered. This we already spoke in the last video in detail. But why are we speaking up? When this embryo, right, binds to this uterus. Say example, this is what the section, this is what the uterus is, and I took the section of this part. So you can see this small inner lining of this uterus. So these are the cells of the uterus, right? You can see inner lining, and you can see the embryo here, right? So let us see the connection. Now they have a barrier between this fetus and the placenta, right? You have got a fetoplacental barrier. So let us see the fetoplacental barrier which is made up of, right? So let us say this embryo has stuck to the uterus now. So this uterus becomes, you can see the uterus, and this uterus becomes what? It becomes the external, right, outside, and these fetus or in becomes inside. So from outside to inside, let us see the structures, right? You can see the first structure. These are the blood vessels, right? You can see the blood vessels of this. You have got a blood vessels because it goes and binds to the blood vessels. With that we'll be dealing. But right now this uterus has got a blood vessels. So first is endothelium of maternal blood vessels. Then comes this one, syncytiotrophoblast, I told you. Then comes the cytotrophoblast, this one, and then comes this extra embryonic somatopleuric mesoderm. This is a somatopleuric, right? We have divided somatopleuric, splanchnopluric, but this part is going to attach. So you have got a somatopleuric mesoderm, right? And you can see that later comes the fetal blood vessels. At this point. So this is the section you have to understand, and this becomes the fetoplacental barrier, right? If you want to see it in clear, let me take the section of only this part of this box and let me show you the section. And that section looks like this. This is what? This is the maternal side, this is the fetal side, and this becomes the maternal. You can see the maternal blood vessels in maternal blood vessels. Then comes the syncytiotrophoblast, and then comes the cytotrophoblast, then comes the extra embryonic mesoderms, then comes the fetal capillaries. So this plays the role of fetoplacental barrier, right, between the fetus and the placenta, fetoplacental barrier. So these are the things you have to understand regarding this fetoplacental barrier. Now let us understand the next concept. The next concept you have to understand here is, let me read first. We are going to deal with the formation of protochordal plate or buccopharyngeal membrane. So let me read first. The hypoblastic cells at one end becomes columnar. They forms an elevation in amniotic cavity called prochordal plate. And prochordal plate, it forms mouth. It determines the cephalic embryo, end of embryo. So what is it trying to tell, right? I took this section, a small part of this section, where you already know that this is what amniotic cavity, this is yolk sac, right? And you know this is what epiblast, and this is hypoblast, right? So we are gonna deal about the protochordal plate now, right? The first thing you have to understand here is, you can see this, right? This is epiblast, this is hypoblast. Hypoblast, what is written in our notes? Hypoblast at one end becomes columnar. You can see these are the normal hypoblast cells, right? But they are normal cuboidal cells. Now at one end, right, they become columnar, right? And they show an elevation to this amniotic cavity, right? They become columnar, right? So yes, I went to the wrong baby. Yes, you can understand that this aspect. It is written that the hypoblastic cells at one end becomes columnar. It forms an elevation into the amniotic cavity, is called protochordal plate. So this elevation should be that, you can see this, suppose this should be like this, right? And these, they show an elevation, right? Whenever you see it from above, right, these columnar cells which has formed now, they show an elevation from when you see it from above. So this elevation is called, what is elevation? This elevation is called prochordal plate. Prochordal plate. So this is what you have to understand. I repeat once again, the hypoblastic cells at one end, they become columnar. They become column. You can see the columnar shape, right? And they form an elevation, right? They form an elevation in the amniotic cavity. This is an amniotic cavity, right? They form, when you see it from above, you can see the elevation point, right? So this is known as prochordal plate. And this prochordal plate, you can look at this prochordal plate, and this section I drew it here, this determines the what cephalic end or caudal end. So let us see what does it define. It defines as, this is a future mouth. This prochordal plate, it forms the future mouth. So it determines the cephalic end and central axis of embryo. So what does it means? So since this is the point of prochordal plate, it means that is gonna form the cephalic end. If that is a cephalic end, the anterior to this protochord will form the head end. So this is a protochordal plate, right? Protochordal plate. So these are the things you have to understand. And the next point written in our notes is, it determines the central axis of embryo, right? If we look at this aspect, this is what you can see. These are, if you see it from above, when you look this from the above aspect, the endodermis, you can see this, this is the point where this hypoblast has become columnar, and this the columnar position. So this becomes the central axis of embryo, right? So these are the things you have to understand regarding this prochordal plate. And now let us understand the next concept. And the next concept you have to understand here is formation of prochordal. Let us see the formation of this. So what is the point written here? Formation of primitive streak. So let me tell you that the epiblastic cells at caudal end grows rapidly and form an elevation in amniotic cavity, right? Now that is called as primitive streak. The round end is called as primitive knot or primitive node. The depression is called blastopore or primitive pit. So what is it trying to tell? If you look at this condition here, right? If you look at normally this is how the epiblast and hypoblast does. But what happens here is, you can see this right, epiblast at the caudal end grows rapidly. This is epiblast, right? They grow rapidly here. So you can see the growth of epiblast rapidly at the caudal end. You can see the growth here. This is epiblast, this is hypoblast. You can see the growth of there's a growth of epiblast at the caudal end rapidly, right? And that rapid growth forms an elevation, and this elevation is called elevation in the amniotic cavity, and this elevation is called, what is that? It is called primitive streak. You can see this elevation, this is called primitive streak, right? And you can observe at this aspect, during the elevation here, right, you got something known as, there's a pit like structure, like you can see the hole here, and this is what it is, primitive pit or blastopore, right? The depression what you can see here, it is blastopore, right? So this is what you have to understand regarding the 2 points. So whenever what you feel like here, you can observe that this is a primitive streak and you can see the primitive pit, right? But now let us see them more clearly here, right? You can observe here, right? Right, so this is the caudal end, right? You can see this is an caudal end, right? If you look at this aspect here, this is what the primitive streak, the elevation what you have seen at the caudal end of epiblastic, because this is an epiblast, this becomes a hypoblast. So at this region you can see this, there is an elevation, so we call it as primitive streak. So you can see down, you can go, and this becomes the primitive node, the round structure which is present anteriorly is called primitive node, and in the center it is called primitive pit. So these are the things you have to understand regarding the formation of primitive streak. Just remember that the primitive streak is formed by the epiblastic cells which are present at the caudal end. They grow rapidly and they form an elevation. You can see that how they are forming the elevation at this point, and this elevation is called primitive streak, right? And at the end of this primitive streak you have got an node or knot, it is known as primitive node or knot. In the center it is called primitive pit, right? So what is primitive pit? I have already told you that the primitive pit is, this depression is called primitive pit, right? So these are the things you have to understand here. Now let me go with the next point. The next thing you have to understand is, fine, we are speaking with this primitive streak. So what is the function of this primitive streak? So the first function of this primitive streak is it forms 3 germ layers, and it forms formation of notochord process. Fate, it disappears. If it persists, it forms an sacrococcygeal teratoma. So what is it trying to tell? So let us see the function of this primitive streak, right? As I told you the first point, this is what, this is epiblast. You can see this is epiblast, this is hypoblast. You can see this is primitive streak, you can see primitive node, and you can see primitive pit. Now you have to understand that the cells of the epiblast which are present here, they migrate into the primitive streak, right? You can observe at this point. So this is an epiblastic cells. The epiblastic cells, they migrate through this primitive pit, right, and they form something. So let us see what they form here. So you can see this is a primitive pit, and epiblast cells are coming inside, right? They are going inside and they form, right? You can observe they are forming something, right? What are those? And that thing you have to understand. These are the cells which have come from this epiblast, and these are mesoderm. They form later mesoderm. So right now we have got 3 layers: ectoderm, mesoderm, and endoderm, right? So now are you free that you know the concepts of formation of 3 germ layers by this primitive streak? Why? The primitive streak, through these only the cells of the epiblast are entering between the epiblast and hypoblast. So that is the reason it's forming mesoderm. So first thing is clear, right? So now let us understand the next concept. What is it trying to tell regarding the notochord process, right? So one thing you have to understand, if you look at this, right, if you look at this, you can see this is an you can see this is an epiblast, this is amniotic cavity, this is yolk sac, right? So you can see the cells which are migrating through this pit also, right? It forms a few cells, they form a notochord process. This is what the notochord process. So are you happy now? The function of the primitive streak is it forms a notochord process, because this is a primitive streak, the elevation, right? You can see few of the parts they are going inside. You can see they are forming a primitive streak, forming a notochord process, right? Notochord process. And this gap is known as notochord, right? You can see the notochord, right? This gap, this what you are seeing, this is notochord. So this is amniotic cavity, this is yolk sac, this becomes the endoderm, right? This is an epiderm, right? You can see this, right? You can see this, what is this? Cloacal membrane. So these three, and you can see the mesoderm at this aspect. I already spoke in the previous. I told you few of the cells, they migrate and they form a mesoderm, right? And that mesoderm, you can observe here, that mesoderm right now it is present at this aspect, right? But this notochord process is formed now. Right now it is formed. The mesoderm is present here, right? So this is known as notochord, and this is what notochord process. So at the end, the function of the primitive streak is formation of this notochord process, right? So these are the things you have to understand. Suppose if this primitive streak, right, if this primitive streak is normally, it should disappear, right? Suppose if this persists, and that can lead to sacroteratoma. So what do you mean by sacroteratoma? You can see the person here, right, baby, at this aspect, you can see at the sacrum aspect, you have got a teratoma. What is teratoma? It contains all the ectoderm, endoderm, mesoderm. Because this primitive streak, it contains those three. So you can see there is a teratoma at this aspect, that is sacral. Why at the sacral aspect? Because this is happening at the caudal end, right? The caudal end is nothing but sacral end. So that is the reason you can see the teratoma at that aspect. And the next thing you have to understand here is formation of notochord. Let's see the formation of notochord and something which is written in the diagram. So it is derived from notochordal process. It disappears except at nucleus pulposus of intervertebral disc, apical ligament of dens, and in the diagram it's written something known as cloacal membrane, primitive streak, blastopore, primitive knot, notochordal process, and the prochordal plate. So let us go with the first one, that is formation of notochord. I have told you this is a notochord here. So this is derived from by this notochordal process. This is a notochordal process. You can see the few other cells which are entering here, that forms a notochord process, and this notochord process, that forms a notochord, right? So this is what notochord is. But one thing you have to understand, that this notochord normally disappears, right? You can see normally disappears normally, but it is persistent, right? In us, it is persistent in the form of nucleus pulposus. What is nucleus pulposus? If you see the vertebral column at this aspect, this is what the nucleus pulposus is between the intervertebral, right? So intervertebral disc. So intervertebral disc, nucleus pulposus of intervertebral, you have got one more vertebra above it, and between that you got a pulposus, that is nucleus pulposus. So that is it's nothing but it is a notochord remnant. And you have got if you see the vertebra here, this is a dens of an vertebra, and this ligament is known as apical ligament of dens, right? That also, like, notochord persists in the form of apical ligament of dens. And now it's time to study about this diagram which is written now. So what is that? What is it trying to tell? When I view the structure of an embryo from the above, right? From the above, this becomes my tail end, this becomes the head end, right? So that becomes my tail end and that becomes my head end. So let us see the structures which are arranged, right? From the tail to the head, right? You can observe here, the first thing you understand here is cloacal membrane. So what is this? This is cloacal membrane. And you can see what is this elevation at the caudal end, that is primitive streak, that is primitive streak. And then comes the hole, this is the blastopore. Blastopore is primitive pit. And then comes this knob or node like structure, this is what? Primitive node. Primitive node. And if you observe carefully, the dotted ones, and these dotted ones are notochord, the gap, right? The notochord process which is present beneath the ectoderm. So that is the reason I drew it dotted here. So this is what? This is what the notochord process is, right? And you can see the notochord at this aspect, and this you can observe, this is what? Prochordal plate. Prochordal plate. So these are the things you have to understand. The elevation, the columnar cells at the anterior aspect is prochordal, and you can see the cloacal. Let's not by heart it, just understand the process of the mechanism what you are seeing from the above. This is how you see actually from the above of an embryo. Embryo. Suppose if this is an embryo at this aspect, right? From the above you are seeing this, right? And these are all the things you have to understand here. And now it's time to read about something intraembryonic mesoderm. So let me read first. It has got an paraaxial mesoderm, intermediate plate mesoderm, lateral plate mesoderm, and this paraxial forms somites. So all the stuffs are written. So let me tell you what is that actually, right? So one thing you have to understand here is, you know the basic concept, right? You know the basic concept. What are the basic concept? You know, that is, you know, this is an epiblast, right? This is hypoblast. This is what? Extra embryonic mesoderm. And this extra embryonic mesoderm, they come between the epiderm and epiblast and hypoblast, right? You can see that. Let me show you the structure here, and this is how the movement of this extra embryonic mesoderm has come inside the epiblast and hypoblast. So this coming inside, right, you can see it, we divide the mesoderm based on the position. This is what? This is axial. This is axial of this embryo. The one which is present beside the axial is paraxial. The one is present in between is intermediate, and the one which is present lateral is lateral plate mesoderm. So this is paraxial mesoderm because it is just to the mesoderm. This is intermediate plate mesoderm, and this is what? Lateral plate mesoderm. So let's see the functions of these paraxial mesoderm. The function of these paraxial mesoderm, if we observe the function of these, so you can see this, the paraxial mesoderm forms somites. So you have to understand the meaning of somites. Somites are nothing but the each of number of segments containing the same internal structure. So what is it trying to tell here? These somites are nothing but it can be dermomyotomes or scleromyotomes. Right, you know the dermatomes which represent the area of, we already spoke, the one like one part of the area they represent only one spinal nerves. So these somatoids can be dermomyotomes, scleromyotomes, and dermomyotomes, they form dermis and skeletal muscle, and the scleromyotomes, since sclera is hard, they form hard substance like vertebral column and the ribs. And the intermediate myotomes, if you look at this intermediate mesoderm, right, intermediate mesoderm, it forms genitourinary system. What is genitourinary system? The system which is related to the reproductive and urinaries. And the next thing you have to understand is lateral plate. Let us understand what is lateral plate. You can see this is the lateral plate of mesoderm. So let me read first. Lateral plate, it encloses the cavity called as intraembryonic coelom, which forms pleural, peritoneal, pericardial cavities, also forms lining of smooth muscles and of blood vessels. It also forms smooth muscles and blood. So what is it trying to tell? If you look at this aspect, right, so there is a slight disturbance here, I'll finish it now. So you can see this is what the extra embryonic mesoderm, and this extra embryonic mesoderm, if you look, it is covering a cavity. This encloses a cavity, and this cavity is called intraembryonic coelom. And this intraembryonic coelom, it forms cavity like pleural cavity, peritoneal cavity, and the pericardial cavity. And this also forms smooth muscles lining the blood vessels. So these are the things you have to understand regarding this intraembryonic mesoderm, because it is present inside between the epiblast and hypoblast. So that is the reason it is called intraembryonic mesoderm. With this we end this topic. In the next session we will be dealing about the other topics. Thank you.